There are a set of rules that relate to the scope of practice for advanced practice nurses in our state that require them to have collaborative relationships, which means that while we'd love to be able to deploy advanced practice nurses more aggressively with respect to MAT training, they have to do it under a data waived provider.
Is that through the federal? Is that federal, the DEAX, or is that through the state?
So I think that where our scope of practice rules different, nurse practitioner in our state, then under the federal rules, nurse practitioners would be able to prescribe differently. But it's the interaction of our state requirements and the federal DEA rules.
And would you support removing that requirement?
I would like to have advanced practice nurses as part of our solution here, that we would be able to deploy them. And I think that we would actually expand our reach substantially.
I agree with you 100%. And the practitioner in the state of New Jersey who provides care to the largest number of substance use disorder patients in the state is an advanced practice nurse and must pay $500 a month for the privilege of having a DEAX in addition to $500 a month for having a DEA. So it's an added burden which increases the cost. She has to have both because she can't prescribe Suboxone or buprenorphine without the DEAX.
And she pays for the physician's DEA fees as well.
Okay. Oh. Right. Neither physician will independently do the other. They both have. So she's paying $1,000 a month for the privilege to take care of substance use disorder patients that many other practitioners don't want to take care of. I've suggested we have a executive order eliminating this because it would increase the number of providers that would address this opioid crisis that we have in the state of New Jersey. I know I'm a broken record on this issue, but the FTC, Federal Trade Commission, says you want to decrease costs, increase the number of providers, you increase competition, you drive down costs, but you also increase the number of providers. It's financially prohibitive for many to get the DEAX. And that's an important, like I said, they're learning in the medical schools that other therapies alone will not solve this opioid crisis. That it's the MAT that in conjunction is what is the only thing that's going to keep people off of these drugs. So that, I think it's really important.